Hi, this is Dr. Serena Satcher from Treat Yourself to Health. And this month we're talking about breast cancer. And in particular, because of my background in physical medicine and rehab and functional medicine, I wanted to talk about how breast cancer can affect your joints and how people with breast cancer can have shoulder and scapular pain as a result of the therapies that they get, the surgeries that they get. So, in the first video, you can look back in the listing here for that first video. I talked about the mechanisms and why it is, and briefly went over some of the things that we can do to reduce the joint pain. I myself had breast cancer some years ago and have been clear of that cancer for the past 4 years. And I'm still being monitored, of course, for recurrence. But I did not go the usual route of the treatment, so I can say though that many women with perimenopause and menopause have drops in their estrogen and do experience similar joint pains, maybe in some different joints. I would say that the hip area and the pelvis are more common than the upper body, but we can lose muscle mass because of the reduction in estrogen, and estrogen is anti-inflammatory, but it also promotes growth. And that's why most people that have had breast cancer are on medications that help to lower their estrogen. So, I want today to connect two things most people never talk about together: the foods you eat after breast cancer and how they affect your joints, your fascia, and your long term recovery. This isn't about a diet or punishment, it's about learning how to eat in a way that protects your body from inflammation, recurrence, and pain. So, and people that I work with in my practice know that I'm not about deprivation at all, and that I want to help people to find whatever their favorite food is. Let's find an alternative that will not, degrade and tear down your body and cause you to have recurrence. We certainly don't want to do that. I want you to notice when you go in your doctor's office, is there a candy jar in the front? And do you eat the candy? And do we understand that that directly ties to inflammation? And typically, candy in the United States is not made out of cane sugar, or it at least has mostly high fructose corn syrup. Sodas are the same way. So we really need to think about, are we digging our graves with our teeth? Are we going to cause a recurrence by the way that we're living? So food isn't just calories, it's information. The food's DNA is actually having a conversation with our DNA and could direct certain chemical messages to your genes. So every bite you take sends a chemical message to your genes. Some foods tell your body to inflame, others tell it to repair. So your fork is your remote control. So after breast cancer, we want to press anti-inflammatory, not flare up in inflammation. So let's talk about some foods that help to protect and rebuild your system. Because after you've had chemotherapy and radiation, if you're not aware, these are designed to kill cells and cause cellular death. So we have to rebuild our systems after we've been through that. I didn't go through that type of therapy. I had a therapy that was not lethal to my cells. So, but address what you have had. And I would say, even not having therapy that was lethal to my cells, I still felt fatigue. So this is something that's kind of universal and needs to be addressed with nutrition. So cruciferous vegetables are number one. They help the liver to metabolize estrogen safely through the 2-hydroxy pathway, reducing recurrence risk. So things like broccoli, kale, cauliflower, Brussels sprouts are all in the kale family, collard greens. So we need to increase our intake of that. I try to eat something from the cruciferous vegetable family every day. Um, Other Asian vegetables fit in this category too, like bok choy, the different choys, which are kind of related to cabbages. Those are all cruciferous vegetables. Sprouts are really nutritious, so I try to eat sprouts every day, a small serving. So, number two, fatty fish and walnuts and some other nuts that have beneficial omega 3s. What comes to mind immediately are sardines, which, you may have some bad memories of sardines from when you were a child, which I did. But when I went to Europe and I had sardines from Spain and from Portugal, it changed my mind because it blew my mind. They were so good. So you can find those here. There's also better sardines that come in like extra virgin olive oil. I love Costco. They carry these, and I believe that Sam's Clubs has some of these too that they sell in multi-packs. Um, they've done studies, and to increase your omega 3s, it is better to eat these small fatty fishes. Other fish that you can consider are like salmon, cod, hake. Um, those are all cold water fish. And then walnuts, which look like the brain, of course, those are good for us. Higher fat fishes, higher fat nuts like Brazil nuts, like macadamia, seeds are also great for getting healthy fats. Then we have the next category are some of the spices like turmeric, from which curcumin comes. It inhibits NF-kappa B, which is a master switch of inflammation. And black pepper, which bioperine comes from, bioperine, I'm probably saying it wrong again, but it accompanies and helps with the absorption of curcumin. Then number four is green tea, and there's a substance called EGCG. It's got a really long name, and that's a detoxifying compound, and it helps to lower oxidative stress. This is part of the reason why people on the Asian continent have very low cancer rates and long lives. They drink a lot of green tea, like every day they drink green tea. Do what works for you. I am not able to drink green tea every day, but I am able to drink it intermittently, and I have to drink the decaf. The caffeine can kind of bother me. But you can get decaffeinated green tea. You can get the EGCG and supplements as well. My favorite is berries and pomegranate. So berries and pomegranate are very high in antioxidants, and they're great for your fascia and for your capillary health. So I try to eat a bowl every day of these berries to try to get natural antioxidants. Flax and chia seeds, they contain lignans that bind excess estrogen metabolites. And did you know a 2011 NIH study found that women who ate flaxseed had lower recurrence rates? So I try to eat flax every day. Um, I add it to foods, chia seeds. I make a pudding with the chia seeds, and I try to have a tablespoon or two in the pudding form every day. It helps with digestion too. Chia seeds also have omega-3s, and so does flaxseed oil. So now let's have a quick reality check. What to reduce? Let's decrease the seed oils and sugary drinks and candy that's made out of refined carbs. Let's eliminate alcohol, which can increase estrogen levels. And if you don't understand that logic, I would encourage you to read many articles written by the health writer at the New York Times in 2024 and 2023 about alcohol. And the conclusion was, you know, doctors, we messed up like in the 80s and the 90s by telling people, a small amount was okay. What we're seeing now is that's not the case. And what you may see if you haven't had cancer is you may see an increase in your LDL cholesterol in the liver because the liver processes all the cholesterol. And when you take in alcohol, it's going to prioritize the alcohol metabolism or getting the alcohol out of the body rather than metabolizing estrogen and other hormones that have to go through the liver, as well as cholesterol. So, this is resulting in more toxicity. So, if you've got any medication or having any issues with your health, it's good to eliminate alcohol. Everybody understands if you have to go to a wedding once a year or something and have a sip of champagne. This is different than having alcohol on a daily basis or drinking until you get drunk at least once a week or once a month. It's going to deteriorate your health. So, also burnt, charred, or processed meats. Um, Again, this isn't punishment, but we know that these charred and processed meats uh, make substances that they're really like the fat gets degraded in the meat, and that degraded fat is toxic and it affects our hormonal levels. And it's not only for breast cancer, but this has been correlated with prostate, with colon. So, burnt meat is not a good idea. So, when you eat nutrient dense, anti inflammatory foods, you're not just protecting against recurrence, you're literally rebuilding tissue. So, imagine your cartilage is like a sponge. When inflammation dries it out, it becomes brittle. But when you feed it antioxidants, hydration, omega-3s, it plumps back up and it moves smoothly again. I call omega-3s like lube. The hydration is like lube too. So if you think of your joints like needing what a car needs, and the car needs a little oil, car needs a little hydration, our joints are like that too. So healthy fascia slides more easily, improving the range of motion, and that means fewer aches when you wake up and when you're active during the day. So, what's a good plan to think of, like on a daily basis, for your nutrition? So, for breakfast, you could have a smoothie that has greens, flax, and berries. And for your probiotics, you could have maybe a tablespoon or two of Greek yogurt in there or a non-dairy Greek type yogurt. And then for lunch, you could have a wild salmon salad with olive oil. For dinner, you could have roasted cauliflower, turmeric, quinoa, which has protein, and green tea. For a snack, you could have a handful of walnuts or pomegranate seeds. And if you can do this 80% of the time, your body will respond beautifully. Your body isn't just your enemy, it's your ally. So when you nourish it with the right foods, it knows how to protect, rebuild, and restore itself. If this was helpful, follow along for more joint and recovery strategies. And remember, healing is about perfection, It's not about perfection. It's about progress. So you can learn more in the show notes. I have a program called the Insight Reset, which is a 30-day starter program. I also have a 7-day joint prehab program that you can join in the show notes. And I will be introducing soon, and you can get on the waiting list for this, an 8-week program addressing prehab and mobility and nutrition and all the things that we've talked about here. I'm actually doing a workshop, and you can check out my website to see the dates for the for the workshop. Thanks for joining.